families from private insurance plans to taxpayer-funded plans. That is a prescription for the type of government largesse that stifles economies and unduly burdens taxpayers. It's not a prescription for reducing the number of uninsured Americans. States and children's advocates should take a second look at this bill. Because of shoddy funding sources, this bill is likely to harm more states and health care programs than it helps. A Heritage Foundation study showed that as many as 28 states, including Michigan, stand to have a net loss of $10 to $700 million in revenue. This bill is designed poorly, funded poorly, and will do little to help lower-income Americans obtain health coverage. The President should veto this bill, and Congress should work in a bipartisan fashion, as we did nearly 10 years ago when the program was created, to make certain children in America have access to a health system.
The time of the gentleman has expired. The gentleman from Michigan is recognized.
Mr. Speaker, I yield to the distinguished gentlewoman from California, Ms. Zeshu, 1 minute.
The gentlewoman from California is recognized for 1 minute.
I thank the chairman of the Energy and Commerce Committee for his devotion to this issue during his entire career in the Congress. I don't think that this is a complicated question that's here before us today. I think that it is very clear. It's very clear in terms of the values of the American people. Why wouldn't a Congress, any Congress, offer health insurance for its most vulnerable citizens, the little ones of our country? That's what's on the floor today. That's what's on the floor. They're smart. You're grinning. You're grinning. But you know what? There are going to be the votes for this bill, and the bill is going to pass. And imagine the person that stands at the doctor's door and not allow children to grow through, the President of the United States. This is a bipartisan effort. The people of our country want us to come together for the families of this country, for the betterment of our country, to make an investment, yes, through taxing tobacco. I would rather tax tobacco and protect the children of our country than to blow $10 billion a month in Iraq. I'm proud of the Democrats. I'm proud of the Republicans that support it. We should pass this and say a prayer that the President will come out of his cloud and sign the bill.
Gentleman's time has expired. Without objection, the gentleman from Texas will claim the time controlled previously by the gentleman from Georgia.
I'd like to recognize a member of the committee, Mr. Shadegg of Arizona, for 2 minutes.
The gentleman from Arizona will be recognized for 2 minutes.
I thank the gentleman for yielding, and I rise in strong support of health care for America's poor and near poor children. I also rise in equally strong opposition to this bill. For more than a decade, I have introduced into the United States Congress every single year a bill that would give every single child covered by this bill health insurance. Indeed, it would provide to every family covered by this bill a source of money, tax funds to them and their family to buy the health insurance they need for them and for their children. But make no mistake about it, this bill is a fraud. And the American people are smart, and they know it's a fraud. This bill is Congress playing fast and loose with the facts. If we're going to have a debate about covering every single American, let's have that debate. But let's don't hide it in a debate about children's health care. The American people are generous to a fault. They want to cover poor children, and they want to cover children who are uninsured. And the SCHIP program we have was supposed to do just that. But this program is a fraud. It doesn't cover just poor and near poor. It covers middle-class families. Some will say, oh, it's capped at 300% of the federal poverty level. But under the law and the language in the bill, states can define income any way they want, and therefore there is no cap on income. It doesn't just cover uninsured children. It covers more children who are insured already than those who are uninsured. CBO says that if we pass this bill, 2 million children currently covered by insurance, getting better coverage than they'll get under this bill, will lose that coverage and go on SCHIP. Be proud of reducing the quality of the care they get. In fact, this bill isn't even limited to children. Indeed,